Welcome to our continuing education series with top business leaders from throughout the region as we bring you important information for your company and employees. My name is Dan Lindblade, President and CEO of the Greater Fort Lauderdale Chamber of Commerce. I'm also part of the leadership team for the South Florida Business Council. And today, our guest is Elizabeth Miller, CEO of Centene's Combined Florida segment. Welcome to the program, Liz.
Thank you very much, Dan.
So great to have you with us. For our listeners and viewers, why don't you share a little bit about your background so you can bring them up to speed?
Sure. I came to Sunshine Health just over a year ago in January 2020 after Centene acquired WellCare. Prior to that, I was the president of WellCare in Florida, running our Florida health plans here, and now run the combined health plans across the state. In terms of my background, I'm actually a nurse and nurse practitioner and transitioned into managed care after completing my business degree at Wharton and really take a population health approach to managed care and to the health of the population that we serve.
That's great. I saw that you went to Wharton, and I have a couple of friends who went there. Great institution for higher education. And your nursing background obviously serves you well at Centene now, and also all the businesses that you've run up to this point in time. But we've been now over a year in COVID, and we've seen a lot of changes. The chamber is just now reopening for our in-person meetings for those who feel comfortable doing that. The vaccinations are rolling out throughout the country, throughout the world for that matter. And from your perspective as the CEO of Centene, how has that either hindered or what have you had to do at Centene in your marketplace? Tell us a little bit about how it's affected you.
In terms of our team, some of the things that we've had to do, really one of the first things that we did as an organization is increase the number of providers within our network that were able to offer telehealth services to our members. There's been a lot of discussion about the increase in telehealth across the provider community to serve remote populations in a time when COVID prevented in-person visits. So really from March 2020 through today, we saw an increase just from a few hundred providers offering telehealth services to over 20,000 across the state. So that was really one big change. In terms of our workforce, at Sunshine Health, we have about 4,000 employees across the state that serve the members and the provider community. And just like many companies, we had to pivot to working from home for really for the foreseeable future until we're able to move back into the office environment. So incredibly, we went really from an office-based organization to a remote organization really quickly and without impacting any of our key performance indicators in terms of the members and the providers.
Interesting. I had my first telehealth visit during COVID, never had it before. I lobbied for telehealth up in Tallahassee and in Washington, D.C. and whatnot, but I'd never really been on a telehealth call. And it was with my 93-year-old mother for one of her physicians. And so that was a great experience. We had all the great touch points that you would expect in an office visit. Of course, you couldn't touch anybody, but they had tools that we could use for blood pressure and all these other things. So the doctor could actually tell what was going on with his patient during that time. I just think it is definitely something that's just going to expand in the future. And as far as our organization and other businesses, remote environment, we did the same thing here at the chamber. What now we're trying to figure out is when are the businesses going to return to the offices? Now, are you going to continue the remote environment for the foreseeable future, or how are you guys planning to go back to the bricks and mortar sensibility?
Right now we're planning on returning. We have 22 offices across the state, including our headquarters in Plantation, Florida. And we are right now planning on beginning to go back to the office in mid-September, approximately, and starting really with certain groups of the management team, and probably doing a hybrid between office and home-based work for the time being, to limit the capacity within the office setting. So that way everybody gets a chance to come in for physical work in the office, but also probably a couple days at home.
Yeah, we're doing that too, some flex scheduling, because we have some single mothers. We also have married couples where both spouses work, and we have to make for a flexible work environment. So it's actually been to our advantage to allow for our employees to work from home, but we're much smaller than you. We only have 12 employees, so not quite the same. In terms of the pandemic, though, have there been any revelations from your perspective about the pandemic that has surprised you, for example?
One thing that surprised me, and I think this is as a nurse and as a mother who's gone through the childhood vaccination efforts with my own family, it's surprising to me that there are so many people that are unwilling or still afraid to take the COVID vaccine. It's really been an incredible innovation, and the fact that we were able to have access to a vaccine in such a short period of time is really quite a breakthrough. And as I reflect, just thinking through vaccinations over time, I mean, really starting with the smallpox vaccine in 1798 and continuing through all of the childhood disease vaccinations and all of the preventable disease vaccinations, it's just been incredible to be able to see that within a year's period of time to have access to the COVID vaccine. So I would say I'm surprised that there's still so many people that are afraid to take it, but I'm optimistic that people are getting more comfortable with the idea of taking the vaccine over time. So I think, I'm trying to be a good example, and I know many of the providers in our community, many of our staff are trying to be good examples just in terms of getting the vaccine. And hopefully we'll get to a point where enough people will get it and we'll reach some level of herd immunity.
That's right. And we're expecting that herd immunity sometime at the end of May, June, July, right in that frame. Does that match up with what you feel will happen, at least for South Florida or Florida?
I mean, I think I heard different things, Dan. So I think that because the vaccine is only 16-year-old and older are eligible for the vaccine, I think it's going to be hard to actually achieve a herd immunity until younger individuals are also eligible. But hopefully we're on track sometime this year to get herd immunity.
Let's switch gears a little bit. Let's talk about some of your product line right now. And I'm speaking specifically about your AmBetter plan that you have. Fill us in on that and tell us how that's achieving great success. We hear such great things about it.
Thanks, Dan. Sure. Our AmBetter product is our health insurance marketplace product. And for the first time ever, we are in right now what's called an off-cycle open enrollment period. And that was just extended through August 15th. So usually to enroll in a marketplace product, you have to have a qualifying event like a job loss or a period of time, which is usually in the fall. But because of COVID, the federal government has enacted something called a Special Enrollment Period, an SEP. And again, that goes through August 15th. And that allows people to enroll in or switch marketplace plans. And really, it's an effort by the federal government to make sure that individuals have access to health insurance during the pandemic. Really recognizing that access to health insurance is one step that ensures access to care. So you really, I would encourage to listeners and watchers, if you're looking to learn more about AmBetter, you can learn more at ambetterfl.com. That's where you can get more detail about our product.
Thank
But
you.
I think it's, one thing that's really interesting about AmBetter, as I mentioned, we have our office in Plantation over on North University Drive. And when you call member services, it's really a local health plan. And when you call member services, you're speaking to somebody from our call center over there. You're speaking to people that are from Florida and live and work in the communities that we serve. So really trying to be a local health plan for the community.
Well, and you've been doing such a great job as Sunshine Health, as Centene. We know that you've been so involved in the communities in which you represent, and we can't thank you enough for that. As it relates to the health insurance marketplace, there's been people on one side or the other side. What's your assessment on the marketplace, healthcare marketplace right now, and how it's working?
The healthcare marketplace has really been an amazing way to make health insurance affordable for individuals that maybe didn't have access to that level of health insurance before. The marketplace right now operates with something called premium tax credits, and those tax credits give individuals the opportunity to purchase health insurance really at a subsidized level. So for people that earn between 100 and 400% of the federal poverty level, who in Florida don't qualify for Medicaid, this allows them to purchase health insurance at a highly subsidized level. And the other thing is, with the American Rescue Plan that was enacted on April 1st, it means that more people will qualify for tax credits at lower premiums. And for some individuals, they even have access to no-cost health insurance through the marketplace. So I think that's really a big benefit for Floridians, because we're still in a pandemic, and it's never been more important to have insurance, and the federal government has offered these subsidies and also extended enrollment through August 15th. And so that's really a great opportunity, I think, for individuals. It offers a level of peace of mind that people haven't had before.
So one of the things that I've noticed, though, is communicating to those in need about these options. Many of them don't have internet. They may not have access to the information. How do you bridge that information to these individuals so that they know that it's available?
Really, I would encourage individuals to check out our AmBetter website. Again, that's just one great place where you can get information about our plan. It's ambetterfl.com. That's one location. And also the health insurance marketplace. The health insurance marketplace has information as well, just about all of the plans that are out there and available for individuals.
Well, I want to also commit to you that we are out in the field all the time, as is another one of our business partners, the Urban League of Broward County, which you guys are very supportive of. And we can communicate to those individuals as well through that avenue. So if any of our listeners have a need, we want to make sure that you can come through us, and we will refer you over to Centene and Sunshine Health to make sure that we make that connection for you. Very, very important that you get that coverage that you need. One of the things that we talked about last week, Liz, was unfortunately, Fort Lauderdale is the epicenter for the highest rate of child poverty in the state of Florida. It's not something I like to talk about or advertise, but it's an important thing that I have to recognize as the chamber president. And I know that underserved communities is one area in which you guys have always participated and always lifted people up. Talk to us about your commitment to community and your commitment as the president to helping those who are less fortunate and underserved.
Thank you, Dan. Yes, that is, that really is the core of what we do and how we try to impact the communities that we serve. And you mentioned a very sobering statistic, and I think we recognize that we're part of the solution there. And we really greatly appreciate your partnership as well in working to address some of this. At Sunshine Health, while we're a health insurance provider, really what we try to do is to make sure that individuals have access to the resources that they need to stay healthy. And so in addition to healthcare, what that often means is healthy food, safe housing, education, job training, childcare even. And those are what we refer to, and I'm sure you've heard this phrase, as the social determinants of health. And so what we're realizing is, big and small businesses, nonprofit groups and churches, this is something that we all have to address and tackle together. And we're very grateful for groups like the Chamber, for helping us bring those stakeholders together to address that. I think, at Sunshine, one of the things that we have is we have a community resources database on our website where anyone, you don't have to be a member, you could be a provider, you could be, a community stakeholder, a church or a nonprofit, anyone, and you can type in your address, you can type in your zip code, and see the places near you where you can get help with food or clothing or housing. So it's really just it's a database that we're constantly updating, making sure that it has the most up-to-date information, so that people can have the access to the services that they need. And it's really a growing understanding that by addressing these social determinants of health, ultimately you can impact individuals and populations' health outcomes. So that's really a tremendous initiative that we have underway with our organization. And for individuals that maybe don't have access to the internet or can't navigate that, we also have a phone number. So it's a community connections helpline. So it's a phone number, anybody can call it and get the same access to those services. So I'm just going to give the number just so you can have it just for reference. It's 1-866-775-2192. And again, anyone can call that number and really help to navigate access to these social services. So I think that's one of the things we've had tremendous uptake on that, on access to the line and to the database throughout COVID. Getting hundreds of requests a week, and we're able to fulfill really able to make the connections for a tremendous amount of needs in the community.
I want to give that number one more time. That's 1-866-775-2192, and you can call that 24/7, I guess.
Right.
Okay.
That's right.
Okay. So lastly, I know you do so much throughout the state. Talk to us a little bit about your investments in the region, South Florida, and the rest of the state too. I think that's a great way to talk about your culture as an organization and your leadership as its CEO.
Thanks, Dan. It's a phenomenal organization. And again, we have so many connections within the communities that we serve. But I'll highlight just a few of them that we're most proud of this year. So one, at the end of 2020, WellCare of Florida was able to donate $15 million to Step Up for Students. So this was a great investment for Florida, and in the future of really that donation will turn into scholarships for over 2,000 school children. It's through the Step Up for Students program. So it's been a multi-year partnership with that organization, something that we're very proud of. Sunshine Health has also really, one of the more recent efforts that we've been working on with COVID has been, we've been part of a health disparity screening initiative, which was, it was really undertaken by our parent company, Centene, in partnership with local federally qualified health centers. And it's been incredible. The initiative was really designed to bring PCR and antibody testing to underserved communities across the country, because research was showing that COVID-19 was disproportionately affecting racial and ethnic minorities. And the company made this commitment, really early on. I think was really early on into that recognition, and really was able to make a difference. So just through this effort, over 1,000 people were given free tests and the option to opt into this study to really help us better understand health disparities and how to proactively alleviate them relative to the COVID-19 pandemic. So that was really something that I think that we were very, very proud of. Another effort, we're working with the College Football National Championship Host Committee. We've done a lot of work with them and teamed up with them for drives and events, distributing things like free groceries and sanitation supplies and other things over the holiday period. So really love working with that organization and the partnership that we have there. We've also done quite a bit with the Florida chapter of the American Academy of Pediatrics. And I mentioned earlier the comments around vaccinations, and this is one group that is really making a difference, and we're happy to support them and partner with them, just really in terms of promoting well child visits, routine vaccinations, and the COVID vaccination. We saw pediatric vaccinations drop during the pandemic because kids weren't going to the doctor. So this was one effort where we were able to team up with this group to really make a difference there. And, I could go on. I mean, we have such a strong team, such a strong footprint across the state. We serve over 2 million individuals across the state. But really what it comes down to is our mission of transforming the health of the community one person at a time. So while we can speak in the big numbers of, serving over 2 million individuals, it really comes down to that one individual and the interactions that we have with them to help lift their health and support healthy communities.
Well, and that's what it's all about, isn't it? One person at a time, one vaccine at a time. We'll make it through this pandemic with Centene's help. You've been doing such a great job in Florida. I want to thank you. It certainly is a pleasure to have you as one of our Chairman's Circle members at the Chamber of Commerce, the Greater Fort Lauderdale Chamber of Commerce. Liz, I wish you the best with you and your team for 2021. Thank you so much.
Thank you, Dan.